From nutrition and improving your memory to heart disease and also cancer, physicians are really making strides now when it comes to women's health care. We have Dr. Sabra Klein from Johns Hopkins joining us now to talk a little bit more about what you do at that hospital. Fill us in.
Well, thank you. So I'm an immunologist, so we really study why it is that women tend to have greater immune responses than men. This can be beneficial when we need to fight an infection or respond to a vaccine like the flu shot that hopefully most people have received this season. But it can be bad in terms of development of inflammatory diseases and even autoimmune diseases.
And there is a difference when it comes to men and women. Can you explain that a little bit?
Absolutely. So women tend to mount more robust and stronger immune responses. And we at Johns Hopkins are starting to uncover that genes on our sex chromosomes, so those two X chromosomes that women have, that one X chromosome that men have, is contributing and playing a role in these differences, as well as our hormonal environment. So having estrogen, for example, or higher concentrations of estrogen actually can boost your immune response. And so we see this in women who have higher estrogen levels, whereas testosterone in men tends to actually suppress the activity of immune cells. And this may also be contributing to why we see these differences.
Wow. There is a women's conference going on right now, actually, still going on at the conference center, which if you're at home watching us, there's a good chance, unfortunately, you'll miss it. But what is that conference all about? To discuss vaccines? And
so it goes beyond vaccines. This conference is focused on bringing to light all that we know and what is cutting edge about women's health, ranging not only from our immune system and responses to vaccines, but to depression, heart disease, stroke, autoimmune disease, lung cancer. These are all topics that are being discussed. And what many women, including those in your audience today, may not realize, many of these diseases are different between women and men. Roughly 60% of all depression patients are women. 80% of all autoimmune disease patients are women. Lung cancer, especially lung cancer in non-smokers, tends to be greater in women as compared with men. We have numerous examples, dementia, Alzheimer's, in which women can often suffer from many of these debilitating diseases to a greater extent than men, and arming women with this information to better understand why this is the case and which treatments could be available to help them is a part of what a woman's journey is about.
So you mentioned treatments. Does that mean that the treatments for men and women vary greatly then?
So today, no. We often, in the biomedical sciences, take a one-size-fits-all approach to medicine. And so in attempting to bring to light the importance of considering women's health and personalizing medicine, it's meetings such as these to raise awareness that we may need different doses, we may need different formulations in order to treat us equally, if you will.
Now, do you see patients, or are you heavily involved in the research
I am
part?
heavily involved in the research, teaching and doing research, so educating our next generation of scientists.
Wow. What is the biggest takeaway, I guess, from a woman's journey?
The biggest takeaway is that women and men differ in their susceptibility, in their outcome, and in their responses to treatments for diseases, and that this spans across the body, from the brain and the heart to lungs to our reproductive tract to our bones.
Wow, very interesting takeaways. Dr. Klein, thank you for sharing a few moments with us and your knowledge. We appreciate it.
I thank you so much for inviting me.